Hello, my name's Brian Ramacco, and today I'd like to talk about a drug that might kill you, a drug that is potentially lethal. And this is a very common drug, a drug that most people have on their shelf. Um, and in fact, it's something people consider benign, and it's not, at least not with chronic use. Now, I am not against drugs. I am for the correct usage of drugs, and I'm particularly cautious about drug use when it's symptom-based and not curative. Is the symptoms bad enough? Risk versus reward. I find that there's more of a discussion to be had about the drug, and you have to make an educated decision about the drug in those cases. Now, getting back to what drug this is, I'm talking about non-steroidal anti-inflammatory drugs, NSAIDs. In particular, I'm talking about the drugs that you can just get over the counter on the shelf in the pharmacy. Your diclofenacs, your Voltarens, your ibuprofen, which is your Advil. These, you're like, yeah, okay. Now, if you follow the directions, it seems to be fine. If you follow the directions. If you read the directions, though, you don't want to be taking this for more than 21 days. You don't want chronic use of these medications because that's when complications arise. These drugs are known for having very bad, with long-term use, very bad gastrointestinal symptoms. They cause ulcers, all sorts of gastrointestinal pain. A lot of people with chronic use end up getting incorrectly diagnosed with GERD, gastrointestinal reflux disease, and put on those drugs. And then maybe some side effects of that, they end on other drugs, and then more drugs, more drugs, more drugs. But as I mentioned, death. There's these old estimates that are floated around the internet. And my goodness, they're I think the earliest case is like 1998 that these estimates were made. So almost over 15 years old. That over 100,000 hospitalizations every year in the States, over 16,000 deaths every year in the States, with the use of these common medications, which provide a little bit of pain relief and are a little bit anti-inflammatory. So yeah, you don't want to use these drugs chronically. Now, if you sprain your ankle, use them. Again, follow the instructions. That's fine, but don't use them chronically. Get to the bottom of your pain. I wrote a whole book about this because I want to help people. Um, but just whatever you do, try to find other solutions to your pain. I have a whole book about trying to find other solutions and delving into trying to get to the bottom of things. Um, but you don't want to be on these drugs long term. Now, there are some alternatives. There are other NSAIDs which don't have the gastrointestinal symptoms. These are COX-2 inhibitors. Celecoxib is a generic name. Celebrex is the name brand. And that doesn't have the gastrointestinal symptoms. Actually, in the past, I've been on that one myself. Yeah, it didn't give me any gastrointestinal symptoms. There are some fears it causes heart problems, but it seems like with most of the recent research on it, that as long as you follow the directions, the risk of that is low. So that's one option, is you can transfer from your ibuprofen to a COX-2 inhibitor like celecoxib, which does require a prescription. So you can talk to your doctor about that. The other option is curcumin. And there's other natural anti-inflammatories. Curcumin is the active ingredient in turmeric. And there's many research studies on this. There was a systematic review done in 2021 for people with knee osteoarthritis. And they found that for pain and function, that curcumin had a similar effect to over-the-counter NSAIDs. And it doesn't have the side effects. If you think about turmeric, yeah, you could just eat Indian food every day, eat curry every day, and you'd be fine. Uh, so there are options for pain relief for as an anti-inflammatory that doesn't require you to take ibuprofen every day of your life. Again, ideally, you find the solution to your pain and you can get off drugs entirely. That's what I hope for everybody. I just wish the best for you. So I wish you luck. Get off of the ibuprofen if you're taking it every day, and all the best. Cheers.